Just my camera, or you can see me?
You're perfect.
Okay,
You're perfect.
Great. Yeah.
All right. So I think we are all set and live. And I'm just checking on Facebook for anybody who is there right now. All right, perfect. We are set. So thank you, everybody, for joining us today for another USCRI Connect series. I'm Ashley Gaudiano, Director of External Affairs for the Connecticut Institute for Refugees and Immigrants. Like many of the other conversations we've had, I'm particularly excited about today's conversation and our guests. Joining me today is Eskinder Negash, President and CEO of USCRI, or the U.S. Committee for Refugees and Immigrants. Welcome, Eskinder. Thank you again for joining me.
Thank you, Ashley.
So we're here today to discuss the U.S. refugee program as it stands today and where we go next. If you are tuning in, you are more than welcome to type comments in on Facebook, and those will stream into us in this software. I will read those in and ask them as we go, or you can type them in and we'll get back to you after the fact. So to jump right in, because we have limited time, Eskinder, can you tell me a little bit about your background? I know you're a refugee yourself, is that correct?
Yeah, that's correct. So I came as a refugee to the U.S. 1981, which is 40 years ago. I was, prior to coming to the U.S., I was working for an organization called the International Rescue Committee, and I was in Sudan. So I got sponsored by IRC and came to the great state of Georgia, and I was resettled there. But I actually came as a refugee without any family sponsorship or connection to the U.S. Yeah.
Okay. Perfect. And we'll go into what that process looks like in just a second for those who are not familiar. And so today you are CEO of USCRI. What happened in between from when you arrived in Georgia to where you are today?
Well, when I arrived in Georgia, as you know, at that time, the refugee resettlement for African was very limited. But being an American nonprofit organization, IRC was my employer and my sponsor. I had some exposure in terms of what to expect. So in Georgia, I was in Atlanta suburb is where I was resettled, and through the help of my sponsor, I found a job, a factory job actually. And it was about, I would say, about an hour and a half or two, sometimes, depending on the bus.
Wow.
Yeah, I was working there, and I was making a lot of money at that time. Minimum wage was $3.35.
We've come a long way.
Yes,
maybe not as far as we'd like, but a long way.
Yeah. So I started there, and then after maybe a year or less, I decided to move to California, and then I was hired again by my former employer, International Rescue Committee. So I worked there for a number of years, providing refugee resettlement, employment counseling, and then I got a job with another organization called International Institutes in Los Angeles, and I worked there about 15, 16 years. And I started as a lower level, but I ended up being the vice president and operations person for that organization.
Wow.
It was, the organization, like your organization, was founded in 1900s. So we had about 200 employees, and we provided service. So I worked there, and then 2001, I came to USCRI for a short period of time. But in 2002, I became a full-time employee of USCRI as a vice president.
So you've really made this type of work your life's work.
Exactly. That's really what I spent in my entire career, was in the service of refugees. I think for me, it was very important that, I share my expertise, but I think given that a lot of people also dedicated their career in trying to help refugees and immigrants, So I was very much attracted from early on because of my own experience also. So I continued to do the work, and then in 2009 I was appointed by President Obama to lead the largest refugee resettlement agency called the Office of Refugee Resettlement under the Department of Health and Human Services. And then after 6 years of service, I came back again to USCRI, and currently I'm serving as CEO of the organization.
That's amazing. Well, thank you for all of your work, both on behalf of CIRI and the clients that we serve. These types of organizations are obviously critical in resettling refugees and supporting immigrants. So thank you.
Sure.
So I know that we talked briefly before we hopped on this about the global scale of the refugee crisis. I know we could spend an entire segment probably just discussing the global scale. But if you were to give an overview of that, that would be really helpful. I don't think many people grasp the magnitude or scale of the problem.
Yeah, that's true. According to UNHCR, this is a UN agency where they issue data every year. Currently, I believe the number of refugees and internally displaced people are about 80 million.
Right.
So keep in mind, if we just if we put them together in one location, they will be one of the largest country in the world.
Right.
Yeah. So that's really, and I'm afraid that given climate change, given conflicts, I suspect that number will grow. And then in the U.S., as you know, we have been very generous. We have resettled about 3.4 million refugees since 1980, almost 42 years. The past 4 years is probably the lowest refugee admission since 1975, because 1975, you remember, the Vietnam War ended, and we decided to bring refugees from Vietnam, Cambodia, and Laos.
Yeah.
And in fact, under the first President Bush, we actually brought in close to 207,000 refugees just in 1 year.
Wow. Wow.
Yeah, this is in addition to the 100,000 Cuban who came in Florida. So it's the number that we used to bring is quite large compared to what we have now. But given the 80 million, the number of refugees we are bringing is a fraction, probably 0.001.
Right, it's a drop in the bucket.
That's a drop. Yeah, and the interesting fact is almost 85% of all refugees and IDPs are in poor countries, hosted by poor countries. We're talking about Uganda, Sudan and Ethiopia. And of course, some of them are in Turkey. The largest refugees, the Syrian refugees, are in Turkey, Egypt, Jordan, and Lebanon. But again, when you compare it to the number of refugees we bring in and the number of refugees they are hosting in their country, is quite dramatic. Yeah.
Wow. So essentially, countries that have, arguably far less than the United States are actually taking in a larger percentage of refugees in total than the U.S.
Yeah, I will give you some example. Maybe Africa is a good place to talk. We have refugees in Sudan, East Sudan. The refugees, Eritrean refugees, have been there since 1968 in refugee camp. Yeah. If you go to Kenya, there is a camp called the Dadaab refugee camp. Been there. They have been there since 1991, and there is about 400 to 500,000 refugees. If you go to Algeria, there is a group of refugees called the Sahrawi refugees. They have been there, I believe, since 1975. So, these are long-term refugees.
Yeah, decades.
Eritrean refugees in Sudan is almost 60 years now. They've been there for maybe second, third generation refugees. So they don't necessarily have, some of them, the right to work, or the right to go to school. but at least have been hosted in that country and living in that country.
Yeah.
So when you compare in terms of the migration and who is hosting who, I think the third world takes look at the current refugees from the Rohingya refugees from Burma going to I believe Sri Lanka. That that number is close to maybe 500,000 or something.
Yeah.
Yeah, and then Sri Lanka is not really a well-known country. Yeah,
Right.
For having resources and things like that. In fact, they struggle with tsunami and things like that.
And so how do you end up in a place, just for people listening, where you have refugees who have been in a host country for, let's say, 60 years?
Yeah. Usually, the country refugees, when they are fleeing, because of war or, ethnic conflict, they go to the next country. So for Eritrean refugees, a border country is Sudan. So they went to Sudan. If Sudanese refugees from Darfur also, they go to the border country, which is Chad. And then for Somalian refugees, the border country is Kenya. So they went to Kenya and they've been there since 1991. So usually, so there are also asylum seekers, they go to different places, included in this country. But normally, refugees cross the international border and go to another country. And that's where they get the refugee status.
Okay, so why don't we keep going there as we look at the, before we go into the kind of current landscape, what is the actual process that a refugee goes through for them to arrive, let's say, in the United States?
Coming to the United States, but keep in mind again, out of this 80 million, we bring in maybe, like last year, I think maybe 30,000 or less. So the process is, the average refugee stays in refugee camp for 17 years. Yeah, and they have
average refugee stays for 17 years in a camp.
Yeah. In fact, we brought in to the U.S. Burundian refugees to the U.S. They stayed in refugee camp for 27 years. They were survivors of the 1972 genocide that happened in that country. So the process takes time, takes patience. And then, if you're lucky to be considered, you have to go through a security vetting process. That takes about 24 months, 2 years. But first, you have to be referred by UNHCR. Normally, that's where the referral comes. And then the U.S., USCI is part of the Department of Homeland Security. You go through their interview. Then, the security vetting process will begin, FBI, background, everything. So the entire process, just the security alone, is about 2 years. And then you have to go through medical screening to make sure that you are not bringing any communicable disease. So it's not an easy process. And then, we have 9 resettlement agencies at the national level. Then, we have a process of identifying, receiving refugees. So, for example, your organization have been resettling refugees since 1980. So you get a number, and then there are about 260 resettlement sites in the U.S. USCRI, we have a partner agency. We do refugee resettlement, including our field office at most 37, 38 locations.
Okay.
And then as your organization, the Catholics and the Lutherans they use their diocese and religious affiliation. They do refugee resettlement. So that's a process, a very long process. Even that, you have to be lucky to get it, to get the chance to come to the U.S.
So 2 follow-up questions to that. First, how does somebody then end up in the United States versus, any other resettling country?
Well, I think, there is a referral system by UNHCR. A lot of the refugee camps are jointly managed by UNHCR and sometimes, the host country. So that referral, you could be referred to Canada, you could be referred to Australia, and it could be. So there is a referral system. And then our administration, the U.S., the White House, every year will make a decision how many refugees will be bringing to the country, in consultation with Congress.
Right.
And then in that decision, there is what they call it regional allocation. So the administration will say, okay, well, 20,000 from this region, for 20,000 from that region. So that's really how the process works.
The numbers get set. Okay.
Yeah, and then the 9 voluntary agencies work together and make a decision in terms of how many they can handle. It's a very voluntary. It's actually one of the best refugee resettlement model we have. It's a public-private partnership, even though there is a very small government funding, but everything that we do is through the support from the community, like your organization, the housing issue, the transportation issue, even though there is a small per capita funding coming out of the federal government, but resettling refugees without any family connection, is a community affair.
Yeah, absolutely. And it lets people really have the support they need on the ground in the community they're being resettled in.
Yeah.
So then my other follow-up question quickly is, I think we hear this myth all the time that refugees just come to the United States, or, refugees land in a camp and then they're here the next day. That's clearly a myth that needs to be busted. Is that accurate?
I think you're right. A lot of people don't understand. In fact, we choose who comes to this country. We actually determine who comes and we go through the security vetting. For example, take Turkey. They got 3 million Syrian refugees. They didn't choose them. They just crossed the border, so they have to take them. Look at Jordan, or Lebanon. 25% of the population of Lebanon is refugees. They didn't choose them. There's no vetting process. They just come, and then they just welcome them. Yeah. Here, we choose them. We go through a process. We make a determination. So it's a completely different system. So people don't understand. Refugees just, don't come through Tijuana.
Right. They don't just appear. Yeah.
Or from Canada to the U.S. and we have to help them. No, refugees are completely different.
Yeah.
We do. Yeah.
Absolutely. And so now a refugee ends up in the U.S. Let's say they end up here in Connecticut.
Yes.
We obviously have a handful of agencies here in Connecticut, but what does that process look like, both the mechanical piece when an individual arrives here, and then also what was your experience when you first arrived in Georgia?
Yeah, the same process applies whether I came 40 years ago or more, even now. So so we worked in our national office, USCRI. We have a number of experts in terms of working and then sort of the bureaucratic process.
Mm-hmm.
And then, once it's determined to come to Connecticut, we will tell you ahead of time. There is a process to assure the clients are coming ahead of time. Once you know that the arrival date, there is a coordination. IOM, as International Office of Migration, is responsible for transportation. And then through that, once you learn they're coming, somebody from your organization, if they don't have family, they go to the airport ahead of time. They try to find an apartment or a house, depending on the size of the family. And through that, you provide them orientation, you help them apply for Social Security card or identity, the Department of Motor Vehicle card.
Right, DMV card, yep.
Yeah, they have to go through another medical screening. They bring in their X-ray, and then they go through another screening process. And then, you try to help them find employment so they become self-sufficient within a short period of time. In the program, I think in the U.S. program, people don't understand. Most refugees are out there to say over 85% or more get a job and become self-sufficient within a short period of time. People don't understand that refugees are also as business creation folks. If you come to Washington,
Absolutely.
I know you used to live in Arlington. I mean, DC is full of former refugees, opening
Yeah.
business, restaurants, taxi drivers. And then if you go to California, 75% of IT companies are founded by either a refugee or an immigrant.
Wow.
Yeah,
That's
so
a
it's
huge number.
yes. So they are not a burden to society or any community for that matter. I mean, you can go to from Lewiston, Maine, to all the way to Minneapolis, Minnesota. You see how refugees are changing their community. They work very hard. They open businesses. They pay tax, and they become part of the fabric of the country.
Yeah.
Uh, and some of them actually serve in the military within a short period of time. The kids are doctors, engineers, and some also, depending their skill, work in the service industry. So we have probably one of the most effective refugee resettlement in the history of this country. I would dare to say. In the past 40 years, refugees have done incredible work from Georgia, from Florida, all the way to Juneau, Alaska. You will see the footprint of refugees, their work ethics and contribution to the local economy. And
Yeah,
to
which
the
is amazing.
Yep, yeah. We have a congresswoman who came in as
Yep.
refugees. Yeah,
Yep.
so it's a very successful program. It's really one of the best programs that I know, probably in the world. Yeah.
Yeah. I had the good fortune maybe 4 or 5 years ago to go to Lewiston, Maine, and see the entire food ecosystem that is
Yes.
really built around
Yeah.
the refugees who live there and who have been resettled there. And it's quite an amazing experience, especially if you
Yeah.
can appreciate the value of local food and,
Yeah.
like I said, that food ecosystem.
Yeah.
It's a neat place to go visit.
Yeah. Well, Lewiston is very interesting. Prior to refugees going there, you used to have one shoe factory in Lewiston,
Right.
and they decided to move to Mexico. So, so the economy was quite depressed. And then
Yeah.
refugees from Somalia, Bantu refugees, came in. I think some of them maybe from Illinois, because refugees are very smart, as you know. They choose community because its housing is affordable. They can get a
Yeah.
job, but at the same time, it's good for their family and their kids in terms of school. So they chose Lewiston. They actually chose as what we call them secondary
Right.
migrant. And now you can see, downtown Lewiston is a completely changed,
Yeah.
community. The same thing with Somalis. They're the largest Somali, probably outside Somalia, is in Minneapolis in terms of refugees. And I can assure you that they didn't go to Minneapolis because of the weather.
No, certainly not.
It's not the way they're accustomed to, but they have completely transformed the city. They're very active. As you can see, the congresswoman is from there, the city council, the state.
Yeah.
I mean, it's Minnesota actually brought in a lot of refugees, Hmong refugees from Laos.
Yeah.
In 1978 and 1979, and then other refugees followed them. But the history of Minnesota, as you probably know, is also an immigrant city, mostly from
Mhm.
Eastern countries. Yeah.
Yeah, and I think reshifting the narrative from refugees being a quote unquote burden to recognizing the economic benefits, in addition to the cultural and social benefits, but certainly the economic benefits that refugees bring to our society and our communities is really important.
Yeah. Well, I think the idea itself, another human being is the burden to another human being doesn't make any
Right.
sense to me. I think especially here, given our history, we're a country of refugees and immigrants. A lot of ordinary folks came to this country and became and did incredible, extraordinary work. So, I mean, that's a good example that a person, regardless where they came from, will never be dependent on another person.
Yeah.
That's really what sometimes we miss the idea, because they have the same dream like all of us. They want the kids to succeed. They want to have good jobs. own house and live a peaceful life.
Yes.
So nobody comes to the US so they can be poor.
Right.
Yeah.
Right. They want to thrive and
Yes.
have a better life for their children in so many
Absolutely.
ways and for generations to come.
Absolutely.
So I want to shift a little bit to talk about some numbers, which I know can be a little boring, but you referenced the cap or the number that the president in consultation with Congress sets, or the presidential determination number. And obviously we've seen that go from, you referenced 207,000, I believe,
Yeah.
all the way to this year, right, where we're obviously much lower. With an average of 95,000 over the past few decades, and now we're down to steadily from 45 to 30,000 to 18, and now to 15,000, and now we're looking at a shift in the other direction. So can you talk a little bit about the numbers, what impact that has had on the program, your work, and then also the global refugee crisis?
Yeah, the global refugee crisis, as I mentioned, is continuing. We have about 80 million refugees and IDPs. I would say maybe about 28, 29 million are refugees and others IDPs. In addition to to the U.S. government decision not to bring a lot of refugees, COVID is also impacting them. So remember that, and even with a vaccine, there will be some vaccine nationalism, will happen.
Right.
If you are refugees in a country, a host country, or living in a refugee camp, you would be the last person to be considered to get the vaccine.
Right, and we've seen that, right, with the headlines splashing that, the U.S. and other wealthier countries are buying up, buying up all the vaccines, and it's going to be a while before some of the other countries have access, unfortunately.
Yeah, in that hierarchy, imagine being a refugee or living in refugee camp, you will be the last human being on earth that will be considered for that. So the impact is significant. We don't have any data, at least I haven't seen any data to show how many refugees are impacted by, in terms of, being sick or died because of COVID. But there is a growing urban refugees in many countries, and those people are not necessarily getting any support. They have to survive under the underground economy. But I can imagine how much they're suffering because of lack of work, lack of resources.
Absolutely.
A lot of the international NGOs, because of COVID, also left the country, and it's like there's no Zoom in the refugee camp or Teams, so they can be reconnected. So I can imagine it has been a very, very difficult, excruciating time for being a refugees or immigrants outside your country of origin. The good news here is in the U.S. I think the Biden administration is working very hard to increase the number of refugees who will be allowed to come to the U.S. As you know, the outgoing administration decided to the ceiling of 15,000, probably the lowest. So what we have heard so far is about 62,500 for this fiscal year.
Right.
But that has to go through a process, and they have to make a determination. And that's not done yet. But we hope that shortly they will be making that announcement. The White House will making that announcement. We don't know exactly what the original allocation will be also. So, that will come with that. The other good news out of this administration is for FY 2022, they are projecting a ceiling of 125,000 refugees. And then somewhere around September this year, they will be making a decision in terms of the ceiling and in terms of from which region that refugees will be coming in. So that's the good news.
That is good news. Slowly.
I think the administration is re-engaging the international community in terms of refugees, because we have been a leader in terms of encouraging other countries to do the same, not to the same level, but just to make sure they do that.
Yeah.
So that leadership is, I think, to some extent, is going to be restored. They have put a lot of very passionate and experts in different positions within the government. So we'll see a significant change, not just in the U.S. refugee resettlement, but in the global space when the issue of refugee resettlement.
And do you think that those numbers are feasible, both the 62,000, assuming that that is the new number for the second half of this year, and the 125,000? Are those doable in the next year?
It's a little bit challenging because the overseas structure has been dismantled from the past 4 years. So, we have to, I have a feeling they will be hiring more people overseas to make sure that the system is still working very well, to make sure that the security vetting, the health vetting, or everything that we have been doing before will be done. So 62,000 is something we can do, but at the same time, the overseas infrastructure could be a challenge. But I think the career staff, State Department, are quite committed people. I think they're very, very passionate, and they will do everything in their power. I'm very sure that to make sure that we get as many refugees as possible. For 2022, I think they will be probably in a much better position. Hopefully at that time, the structure will be fully restored. They will have people with experience and expertise to do the processing work.
Okay. And so those roadblocks are overseas. Are we facing any roadblocks here with the 9 resettlement agencies, or is everything here ready to go and, we're ready to receive?
Well, I think, we go through a consultation process with State Department, with the Department of Health and Human Services to make sure that we have the capacity to provide services. So it's going to be an ongoing discussion. But as you know, we have been around, like your organization, like USCRI, we have been around for a long period of time. A lot of the USCRI partners have a very diverse portfolio in terms of providing services. For example, USCRI, we provide services for refugee resettlement. We help unaccompanied minors. We help foreign victims of human trafficking. And we actually have a small shelter helping unaccompanied minors come to the U.S. And they provide legal services, as you guys are quite good in terms of providing legal services. So that diversity is very helpful. We are actually the only network we didn't shut down. So we have currently about over 200 partners and sub-grantees around the country. So we are everywhere. But I think the strength of our network is that history that we bring, being part of the community for over 100 years. Like USCRI, this is our 110 year of providing services and welcoming refugees and immigrants. So like your organization, I think it was financially challenging, but the challenge of the refugees is much worse than ours.
Agree. We have, while we've resettled less refugees this year than in years prior, the demand for services still exists, and certainly the need is still there. So we've been grateful to work with both the newly resettled refugees, but also the hundreds of refugees that have been here for a few years who still really need support. Especially, this year we've seen a tremendous need with the academic side of things for many of the children, and just the need for additional support in remote learning environments. So we've been able to do some of that work in a deeper, more impactful way than if we had a heavy influx of refugees this year.
Absolutely.
So we're coming to a close, and I want to be respectful of the time you've given us. 2 more questions. So is there anything else that you kind of want to share with people about the refugee crisis, about what we're looking at in the upcoming years? Anything we've missed?
Well, I think one thing is to emphasize is in the past 4 years, what we learned is how the community of resettlement communities are very, very supportive. I think your organization, our organization, a lot of this organization got a lot of support from the community. I think it was a reminder that what we do has value. It's supported by the local community. So that was actually a wonderful thing to see and to witness, especially for people who do this refugee resettlement. Sometimes it's a little bit depressing, what in terms of language and other issues that we have been dealing with for the past 4 years. So I think all of us are quite touched by the support we get from the community around the country. And that's really what the true meaning of our model of refugee resettlement, this private and public partnership. So that was a good and reaffirming that what we do has value, and serving people is always a meaningful way to live life. So we're very, very touched by that. Yeah.
Absolutely. So I'll ask you, the kind of question that we always get is, what can people do to help, right? And obviously what they can do to help at the national or international level is different than at the local. But what do you tell people to do? Do they advocate? Do they donate? Do they volunteer?
Yeah, I think, at the national level, we do a lot of advocacy work, and, USCRI has been for almost 65 years, we have done the advocacy work. In fact, USCRI advocacy work started at the request of President Eisenhower in 1959.
Wow.
So we have a long history of providing advocacy work. We have a division within USCRI called Policy and Advocacy. We publish the reports, and we wanted to make sure that we are providing a solution-based advocacy for some of this intricate policy challenges. So, and supporting the work, our work is supported for individual giving, foundation support, but at the local level, I think your organization, others, really depend on the support of the community, whether it's volunteering work or in-kind donation or other donation, or helping with employment in hiring refugees. All of that is a contribution. At the end of the day, it's just, there's a saying in Africa, the village, you raise the child. It takes a village to raise a child. It takes actually the whole community to do an effective refugee resettlement, and I think that's going to be very, very crucial.
I agree. I've certainly followed your policy and advocacy work for quite some time, so I urge others to do the same on your website.
Yes,
and I know locally we count on a lot of community volunteers to do everything from helping set up apartments for newly arriving refugees to tutoring and mentoring. So there's certainly ways for those interested to get involved with Syria and with agencies around the country.
Absolutely.
So I want to thank you very, very much for your time. I know you're very busy and doing really critical work, especially right now. So thank you for spending a little bit of time with me.
Thank you, Ashley. Yeah.
And,
thank you.
For anybody who's watching or who wants to watch later, the recorded version will both be on our Facebook page and uploaded to our website within the next day or two. So feel free to take a look that way. And, we'll be back in about 2 weeks with another SCRI Connect on unaccompanied minors.
Great. Thank you.
Have a great day, Eskinder. I really appreciate your time.
Thank you, Ashley.
All right. Bye.